So what do we recommend for monitoring and surveillance for individuals who are receiving nitisinone? As I mentioned, monitoring plasma amino acids is an important part of this. Again, not to be surprised, tyrosine is going to be 800 to 900 on this 2 milligram dose. We are not sort of immediately recommending dietary restriction for all patients receiving nitisinone. That's more for individuals who do develop the keratopathy. If a patient develops keratopathy, we recommend temporarily interrupting the nitisinone treatment to allow those ocular findings to resolve, and then consider implementing a diet with the help of our biochemical nutritionists who are well versed in medical foods that are low in tyrosine and phenylalanine in combination with natural protein to try to keep plasma tyrosine levels at or below 500 micromolar. In addition, we recommend patients be followed by ophthalmology. A good baseline exam before starting nitisinone is really helpful to know where patients are at before they start the medication. I'm fairly conservative, so I recommend having another exam with an ophthalmologist about 2 months after starting the nitisinone, just to make sure that the patients are all doing well. And if everything is fine at that point, they can go to annual ophthalmology exams. And then we also recommend monitoring liver enzymes. We've seen a couple of individuals who've had minor elevations in liver enzymes. It is not known to be associated with nitisinone. Usually these individuals are on many medications, but it's something in particular for individuals who are on multiple medications, we think it's important to monitor those individuals. And again, we would do those probably 2 months after starting the medication. And if everything is proceeding normally, then they can be checked yearly.
Important safety information. Indications. Harlequin is indicated for the reduction of urine homogentisic acid, HGA, in adult patients with alkaptonuria, AKU. Important safety information. Do not prescribe Harlequin to patients allergic to nitisinone or any other contained ingredients. Warnings and precautions. Ocular symptoms and hyperkeratotic plaques due to elevated plasma tyrosine level. Ocular signs and symptoms including keratitis, corneal opacities, corneal irritation, corneal ulcers, conjunctivitis, eye pain, and photophobia have been reported in patients. Perform slit lamp examination prior to treatment and regularly thereafter. Re-examine patients if symptoms develop or tyrosine levels are greater than 500 micromoles per liter. Assess plasma tyrosine levels in patients with an abrupt change in neurological status. Perform a clinical laboratory assessment, including plasma tyrosine levels, in patients with an abrupt change in neurological status. Leukopenia and severe thrombocytopenia. In clinical trials, patients with hereditary tyrosinemia type 1, HT1, treated with another oral formulation of nitisinone and dietary restriction, developed reversible leukopenia, thrombocytopenia, or both. No patients developed infections or bleeding as a result of the episodes of leukopenia and thrombocytopenia. Monitor platelet and white blood cell counts during Harlequin therapy. Adverse reactions. The most common adverse reactions, greater than or equal to 1%, reported in patients with AKU taking nitisinone in clinical trials are elevated tyrosine levels, thrombocytopenia, and keratitis. Drug interactions. Nitisinone is a moderate CYP2C9 inhibitor and a weak CYP2E1 inducer. Potential clinical impact of Harlequin administration with CYP2C9 substrates. Reduce the dosage of the co-administered drugs metabolized by CYP2C9 by half. Additional dosage adjustments may be needed. Nitisinone is an inhibitor of OAT1/OAT3. Potential clinical impact of administration with OAT1/OAT3 substrates. Patients should be monitored for potential adverse reactions. Use in specific populations. Pregnancy. Limited available data with nitisinone use in pregnant women are not sufficient to determine a drug-associated risk of adverse developmental outcomes. The background risk of major birth defects and miscarriage for the indicated population is unknown. All pregnancies have a background risk of birth defect, loss, or other adverse outcomes. Lactation. The developmental and health benefits of breastfeeding should be considered against the mother's clinical need for Harlequin, along with potential adverse effects on the breastfed infant from Harlequin or from the underlying maternal condition. Pediatric use. The safety and effectiveness of Harlequin have not been established in pediatric patients with AKU. Geriatric use, insufficient data from clinical studies of Harlequin to determine if patients greater than or equal to 65 years of age respond differently. Elderly patients should be cautious reflecting any decreased hepatic, renal, or cardiac function, and of concomitant disease or other drug therapy. For more detailed information, please refer to the full prescribing information at harlequin.com/PI. To report suspected adverse reactions, contact Cycle Pharmaceuticals at 1-855-831-5413 or the FDA at 1-800-FDA-1088 or www.fda.gov/medwatch.